This past weekend, I put out a Tweetstorm or Twitter rant where I discussed my concerns about the way we're adopting digital technology during the COVID-19 pandemic and what that means in terms of cybersecurity. Because quite frankly, we're not investing as much as we should in cybersecurity, but we're investing a lot rapidly in the adoption of a whole suite of technologies, everything from IoT to contact tracing to AI-based systems for healthcare. I got quite a few messages privately asking me to elaborate a bit more on this tweetstorm that I went on, and that's exactly what I'm going to do in this video. Let's start with a brief history lesson that I think we should all know by now. Healthcare has been underinvested in when it comes to cybersecurity. And by that, I don't just mean technology, I mean people and processes too. We do not have enough cybersecurity professionals working in healthcare, and the ones that are there are not receiving enough support to flourish to the level of leadership that they could be. With that in mind, that underinvestment in security hasn't been matched by an underinvestment in general healthcare IT, which is a good thing. We need a greater investment in healthcare IT so that we can really reach a point where we have interoperable, patient-centered care that's empowered by technology. We all want that. But in a previous video, which you can see a link to above, I discussed how that mismatch between digital maturity and security maturity has made healthcare a very attractive target to attack, essentially. So let's take a pause here and just think about the different types of technologies. There's IoT, there's telehealth systems, there are cloud-based solutions, there are now contact tracing platforms at a national level in some countries that's likely to spread, to be honest. And all of these have to work together. They have to be integrated together within a single institution, but also we need integration and interoperability across institutions, all the way from central governments through to local and regional health systems and in between those as well. So this is creating a real challenging environment to secure. Add to the fact that a lot of the suppliers that healthcare providers are dealing with don't necessarily prioritize security either. It's for some an afterthought, or equally, they simply don't have the resource to address security the way they want to. And that's creating a real problem for where healthcare was before the COVID-19 pandemic kicked in. And as we'll see, the pandemic created a whole suite of new issues. What we've seen is that as the coronavirus has spread and the pandemic has taken shape, we've become really dependent on technology more than ever before. But what the pandemic has shown is that it's the interoperability of these systems that will emerge that is both the most valuable thing about how we use technology, but also is what's going to create the greatest level of risk, because suddenly you're looking at one new platform application, such as the contact tracing platform, and that is the perfect target for compromise to spread, say, ransomware to multiple adjacent systems. Add to this the fact that attackers have actually become more sophisticated and savvy when it comes to healthcare. They've prioritized healthcare for a start, especially because of the pandemic. But they also understand the importance of creating clinical urgency in order to get what they want, such as a ransom getting paid. They will look for the healthcare organizations that are most digitally mature, but least security mature, as I keep referencing to that model. And what they will do is compromise clinical services and clinical workflows, essentially by compromising the system with ransomware, knowing that that threat to patient safety is more likely to lead to their desired outcome. And the fact is also, unfortunately, that the pandemic has made social engineering that much easier because it's preying on the fears and anxieties of people. And so you label everything to do with coronavirus or COVID-19 when it comes to email phishing attempts, and you have a savvier, higher success rate potential form of getting into these systems or networks to begin with. So really, the entire ecosystem that we have in healthcare has become much more susceptible from a digital threat surface area, but also from a method of compromise. So let's take a pause here. We've seen an underinvestment in the system, in technology, in people, in processes. We have increased interoperability between a whole range of new technologies being adopted because of the increasing digital maturity of the health system, and we have savvier attackers. That's where we are today when it comes to our response to the pandemic from a technological perspective. But in terms of the threat from a cybersecurity perspective, it is going through the roof, and we're going to be dealing with this in the weeks and months ahead. What worries me as well is that when we do discuss security, it's with a focus almost purely on the privacy element of these new technologies and platforms, such as contact tracing. We are not discussing enough the destructive potential that comes with these new technologies like I've discussed, such as ransomware. I really can't put more of an emphasis on how important it is that we understand the threat to patient safety in terms of morbidity, if not mortality, from the compromise of these systems. Because ultimately, we are talking about radiology, laboratory systems, we're talking about critical care systems being shut down at a time when we need them most. So it's important that we shift the balance a little bit in terms of focus so that we understand both that, yes, the privacy element is important in all of the discussions, but also the destructive components, which have a clear connection to clinical risk, are addressed too. At the end of the day, when I put out all my tweets, it was in an attempt to get the community that's reporting on cybersecurity and healthcare and the pandemic in terms of technology to appreciate the challenges that clinicians have to deal with on the front line, and that ultimately the role of technology is a key enabler when it comes to dealing with the pandemic, but it is introducing risks that could be really destructive in nature. And we need to get on top of this now by elevating our rhetoric, but also, of course, our investment in security when it comes to people, processes, and technology, so that we can circumvent the issues that are going to come in the weeks, months, and even years to come by thinking about those issues now rather than dealing with them in a reactive rather than proactive way in the future. So I hope I've broken down my Tweetstorm in a way that makes sense. And if you've enjoyed this video, please make sure to like, comment, and subscribe.